Hi and welcome back to the AQA GCSE History, Britain Health and the People revision series. This is episode 19, which is the last episode in this series looking at the course's content. But for now, we're going to be looking at the National Health Service. In 1948, the Labour government implemented Beveridge's last proposal, a National Health Service. Bevan was the Labour Minister of Health who, after a lot of negotiation, introduced the National Health Service, the NHS. The government nationalised hospitals and put them under local authority control. Treatment was made free for all patients. There were arguments for and against the NHS. For the NHS, during World War II, the government took control of all hospitals, creating the Emergency Medical Service. Its success led many to support the creation of the NHS. The NHS would make medical care free, so it was accessible to everyone. The NHS guaranteed that hospitals would receive government money, rather than having to rely on charities for money. For against the NHS, many Conservatives opposed the NHS as they believed the cost would be just too big. Doctors saw themselves as independent professionals. They didn't want to be controlled by the government. They also worried about loss of income. Many doctors threatened to go on strike in protest against the NHS. Even though many Conservatives were opposed to the creation of the NHS, they couldn't abolish it. When they came back into power in 1951, it was just too popular. The NHS increased the number of people with access to healthcare. The number of doctors doubled between 1948 to 1973 to keep up with the demand. Today, the NHS provides a range of health services, most of which are free and accessible to anyone. They include accident and emergency care, maternity care, major surgery, as well as pharmacies, dentists, mental health services, sexual health services, and general practitioners. An increase in life expectancy means that there are many more older people living in Britain today than there were back in 1948. These older people are more likely to suffer from long-term health conditions like diabetes and heart disease. They need regular medical attention and require a lot of NHS time and resources. The lifestyle choices that people make have a great impact on their health and consequently puts a massive strain on the NHS. Smoking, obesity and alcohol consumption can all harm people's health and may require expensive treatment. For example, smoking can cause lung cancer and drinking in excess can cause serious liver disease. Many modern treatments, equipment and medicines are very expensive, and the NHS has had to face rising expectations of what it can and should offer. As a result of all these factors, the cost of the NHS is rising rapidly. In 2015 and 2016, the NHS budget was £116 billion. In order to stay within its budget, the NHS sometimes must make difficult decisions by which treatments it can and can't provide. So that's the end of episode 19, and now we've finished the entire course of the AQA GCSE History, Britain Health and the People revision series. Thank you for watching, and I hope you enjoyed.